Hello. Today I will be talking about shoulder pain treatment by injections. Being an orthopedic surgeon, I treat shoulder conditions mainly by arthroscopy and joint replacement. I recommend injections after physiotherapy and painkillers have failed to relieve pain. I will continue to offer surgical options after injections have failed. How do I deal with shoulder pain? Mainly from the history, then a clinical examination, and by x rays, MRI to confirm the diagnosis. I then decide if the patient will benefit from an injection. Injection of the shoulder joint could be a part of the treatment of shoulder pain if the pain is more severe than what the patient can handle. After that, one can still continue with the therapy and it becomes easier. So, which are the patients which will benefit from an injection? The patient has pain with restricted shoulder movement, a patient that has got night pain, and patients which cannot lie on the side due to shoulder pain, older people with rotator cuff tears, sports persons with shoulder pain in the middle of the sporting season when the surgery can lead to several months of absence from the sport due to recuperation. What are the conditions which I treat by injections? Early painful stage of adhesive capsulitis, calcium deposition, subacromial impingement usually due to a rotator cuff tear, AC joint arthritis, glenohumeral arthritis, partial and full thickness rotator cuff tears, biceps tendinitis, subscapular bursitis, and sternoclavicular arthritis. So, which are the areas and structures that I inject? So, you know a little bit of the anatomy. The shoulder has got two joints, the main shoulder joint and the collarbone joint above. All these are lined by articular cartilage. When the cartilage breaks down, that can cause shoulder pain. Then there are four tendons known as the rotator cuff. These tendons can get frayed by degeneration and they can also lead to pain. Tearing of these rotator cuff tendons, AC joint arthritis, joint arthritis, shoulder arthritis all lead to pain. Then also you have pain in the early stages of a frozen shoulder. So the structures I would inject in the shoulder are the glenohumeral joint, the AC joint, the subacromial bursa, rotator cuff and biceps tendons. How are the injections performed? You can give them blindly, but there is a risk of error. So ultrasound targeted injections are best as they visualize the organ or tissue and precise injection can be given. Patients will benefit from this as it is less painful, there is no fiddling about, and exactly the dose is delivered where it needs to go. The procedure is quicker and less painful. Guided injection require training and practice. The procedure has to be explained so that the patient does not faint. The local anesthesia is given, and I can also give a suprascapular nerve block which will numb all the areas concerned. Now I'm going to play a small video explaining the ultrasound machine. Watch this please. Hello. Now I'm going to show you how the ultrasound works. This is the ultrasound machine. This is a probe. This is used routinely for musculoskeletal ultrasound. Its frequency is 12. So what are the substances that I inject? I inject corticosteroids, hyaluronic acid, PRP, MSCs and recombinant collagen. Corticosteroids possess anti-inflammatory properties and they can decrease the inflammation in the early stages of a frozen shoulder. Hyaluronic acid is a lubricating agent, synthetic lubricating agent, and it can lubricate it can cause a physical barrier to rough surfaces, but the effect will last for only a few months. Platelet-rich plasma or PRP is prepared from venous blood by centrifuging a small volume to sediment the cells and concentrate the platelets by a bedside centrifuge. Platelets are tiny cells which contain granules, and when they come into contact with an external tissue, they release these growth factors. Growth factors help to repair and regenerate tendon and cartilage. So they can help in AC joint arthritis or rotator cuff tendons or in the main shoulder joint. The fourth one is medicinal signaling cells or MSCs. Medicinal signaling cells are reparative and they can also self-replicate. When injected into a joint or the tendon, they can cause the local repair cells to multiply and repair the damaged tissue. MSCs are usually harvested from fat or from bone marrow. I do it from fat. And the final one is a scaffold. A scaffold is a matrix or a framework on which cells can regenerate. Collagen is a scaffold. You can also use hydroxyapatite when you are treating bone. Recently, I have treated a case of rotator cuff tear with a human recombinant collagen used as a scaffold. I used platelet-rich plasma, mixed it with the recombinant collagen and injected into the rotator cuff tendon. Collagen scaffolds can enhance the healing rate and decrease the inflammation. Now, I'm going to play a video showing how a patient benefited from a shoulder injection.
अभी आपका दर्द कैसा है?
कम है बोलो।
कम है।
कम है? इंजेक्शन का दर्द खत्म हो गया?
खत्म हो गया।
अभी हाथ बायां दाहिना हाथ ऊपर उठाइए। दाहिना हाथ
ओलो ओलो ओलो
उठा ना, दाहिना
एक का ही उठा होगा।
दाहिना एक्चुअली बाएं से ज्यादा उठ रहा है। नीचे लाइए।
दोनों ये सही रहेगा साथ।
If you like this video, you will see more videos like this in my YouTube site where you can see patient testimonials and procedures of shoulder operations, shoulder injections, arthroscopy, etc. My main website for shoulder disorders is shoulderindia.com. My YouTube link is youtube.com/user/A.K.Venkat. If you type Madras Joint Replacement Center in your YouTube, you will reach my link. It's a round logo MJRC. So go ahead, watch these procedures, share it with your friends, and don't forget to subscribe. I hope this talk was beneficial to you for those of you who are suffering from shoulder pain. Now, you don't have to endure this pain. You just have to send me an email, fix up an appointment, and the injection is done within 10 minutes. Then you can go back and lead a pain-free life.